क्या हम तय करें कि 2019 जब महात्मा गांधी की 150वीं जयंती बनाएंगे, हमारा गांव, हमारा शहर, हमारा गली, हमारा मोहल्ला, हमारी स्कूल, हमारे मंदिर, हमारे अस्पताल, सभी क्षेत्र गंदगी का नामो निशान नहीं रहने देंगे।
The year 2014 marked a tectonic shift in Bharat's approach to public hygiene and sanitation. Swachh Bharat Mission will be remembered as one of the biggest achievements of the Narendra Modi-led administration. Bharat Swachh Bharat Mission, SBM, may have contributed to averting 60,000 to 70,000 infant deaths annually, as per a study published in the prestigious international science journal, Nature. 5 researchers have conducted the study, and the article in Nature is titled, quote, Toilet Construction Under the Swachh Bharat Mission and Infant Mortality in India, unquote.
मैं इस तैयारी के साथ आया हूं कि मेरे 125 करोड़ देशवासी, भारत मां के संतान, हमारी इस भारत मां को अब गंदा नहीं रहने देंगे।
SBM was launched by Prime Minister Narendra Modi on the 2nd of October 2014 as the world's largest sanitation program aimed at turning Bharat into an open, defecation-free nation by 2020. More than 11 crore household toilets were built under the Swachh Bharat Mission Grameen as of 2020, and over 6 lakh villages were declared open, defecation-free in just 6 years between 2014 and 2020. Under the Swachh Bharat Mission, urban, over 63 lakh individual household toilets and 6.36 lakh community public toilets have been built. 5 researchers, Suman Chakrabarti, Soira Gune, Tim A. Bruckner, Julie Strominger and Parvati Singh have authored the article that says a quasi-experimental study was done to investigate the association between the Swachh Bharat Mission and infant mortality rate and under 5 mortality rates or U5MR in Bharat. Data from 35 Indian states and 640 districts was analysed spanning a period of 10 years between 2011 to 2020. Now let's see what the study found. While the study noted an overall decline in infant mortality during 2003 to 2020, it said the fall was particularly noteworthy between 2015 onwards. For instance, the study said in 2003, the average toilet coverage in a district was below 40%, and by 2020 this went up to 60%. The post-SBM period in India exhibited accelerated reductions in infant and child mortality compared to the pre-Swachh Bharat Mission years. Based on the regression estimates, the provision of toilets at scale may have contributed to averting approximately 60,000 to 70,000 infant deaths annually. This is what the article mentioned. Results from the study suggest every 10 percentage point increase in district level toilet access following SBM corresponds with a reduction in district level IMR by 0.9 points and U5MR by 1.1 points on average. Improvement of water and sanitation conditions may reduce infant mortality, particularly in countries like Bharat where open defecation is highly prevalent. That's what the article says. The article also mentions that study provides evidence of benefits of India's national sanitation campaign, the Swachh Bharat Mission or Clean India Mission, for infant and child mortality reduction. Our findings add to the growing body of evidence linking national sanitation campaigns to improved child health outcomes and emphasizes the need for similar interventions in other low and middle income countries. The study found evidence of a threshold effect at district level toilet coverage of 30% and above corresponds with substantial reductions in infant and child mortality. The study provides novel evidence of reductions in infant and child mortality following a comprehensive national sanitation program in our country, potentially indicating the transformative role of the Swachh Bharat Mission. The article further says that infant and child mortality due to fecal pathogen-based infections, diarrhea in particular, and malabsorption of nutrients may decline following improved access to toilets and elimination of open defecation. According to this report, in 2003, the infant mortality rate in a majority of the districts exceeded 60 per 1,000 live births with a district mean of 48.9. These included districts in Rajasthan, Madhya Pradesh, Gujarat, Maharashtra, Odisha, Telangana, Tamil Nadu, West Bengal, Assam, Uttar Pradesh, Uttarakhand, Punjab, Haryana and Himachal Pradesh. But by 2020, the deaths had fallen below 30 per thousand live births, with the district mean of 23.5. In 2012, the infant deaths reported was 40 per thousand live births per district, which fell to about 33 in 2016 and further dropped below 30 by 2019. Likewise, the deaths of children under the age of 5 in 2012 was about 44 per thousand live births per district. It dropped to below 40 in 2014, 35 in 2016 and in 2019 it was below 30. Sharing the findings of the study on X, Prime Minister Narendra Modi said, and I quote, "Happy to see research highlighting the impact of efforts like the Swachh Bharat Mission. Access to proper toilets plays a critical role in reducing infant and child mortality. Clean, safe sanitation has become a game changer for public health, and I am glad that India has taken the lead in this." Unquote. Swachh Bharat Mission has been one of the biggest landmark achievements of the government, having far-reaching impact, including generational improvements in health indicators and safety of women and girls.